Hello everyone, welcome to Ask Giri the Physio Show. Today we're gonna just casually talk about know your physio. How much do you know about your physiotherapist? About the training, what they do, how they train and how they learn, how they treat, what they expect from them and what physios expect from the patients and what we believe in. That's what we're going to talk about today. Very casual talk and no slides, nothing like that. So, what it takes to become a physiotherapist. It has changed in the last 2-3 decades. Before we have to do after high school, you do a bachelor's of physical therapy for about 4 years. Then if you want to do masters after that, you do masters of physical therapy for 2 years, and then you become a master of physical therapist. And you don't have to do a master's; you can just finish your bachelor's and you can be a physiotherapist as well. So now the curriculums have changed a little bit. Now, after your high school, you go to any bachelor's degree. It can be biotechnology or chemistry or kinesiology, anything. Then you have a process of doing your interview and your good grades to get into masters in physical therapy directly. What they did is they kind of compressed the curriculum, bachelor's curriculum, and then they call it a masters now. And then you become a physical therapist after that. So that's what it takes to become a physiotherapist. But our learning process doesn't stop after graduation. We continuously learn so many professional courses, ongoing interests, conferences to make sure that we have up-to-date knowledge and evidence-based knowledge to treat our clients in the most evidence-based way. Okay. What do you expect? What you can expect when you go to see a physiotherapist? Most of you would have already seen a physiotherapist. You know what to expect. But some people still don't know what to expect from a physiotherapist or a physiotherapy clinic, right? You call in, you have a problem, you make an appointment, you go in there. Always try to go in maybe 10-15 minutes earlier, especially the first day, so that you can do your paperwork on time. When you have 11 o'clock appointment, try to get in there by 10:45 so that you can just find a way to park and everything and finish your paperwork on time. Some clinics even email you the paperwork, you can finish it at home and take it to the physiotherapist and then make sure you're on time. Physiotherapists usually run a very tight schedule. It takes one patient to mess up the whole schedule. Sometimes if you come late and it just affects the whole day. So try to be on time. Sometimes physiotherapists can run late also, and it can go both ways, right? So we'll try to run our schedule as tight as possible and then go on time and fill your paperwork. Then either a physiotherapy assistant will take you inside to see a physiotherapist, or physiotherapist himself or herself come out and then get you in and then go for a nice subjective examination, asking a lot of questions about your history, health history, your injury and what happened to you, what are your goals. And we are very goal-oriented, patient-centered, evidence-based treatment practitioners. So we always want to know what your goals are. So even before you see a physiotherapist, you kind of mentally organize yourself. What are my real issues are, what are my goals are, what my expectations are from physiotherapists. So we can discuss that during your appointment and clarify that. Clarity is very important when it comes to your health, right? And you can tell your expectations, your goals, then we can address that. And if it is unrealistic expectation, we can even openly say that to you. Hey, this is a realistic expectation, this is unrealistic. So let's have this goal and have a long-term goal, short-term goal. Then we'll have some plan to get to that session goal, to get to that short-term goal. So we're going to be very open with you. We're going to be in the biopsychosocial model, right? And not just biomedical model. And we have to talk about everything. Physiotherapist is not just your healer. Physiotherapist is your life coach. And that's how you have to look at them. They're not going to just talk about your shoulder or your muscles and the joints and your pain. And we have to make sure that you sleep well, you hydrate well, you have an active lifestyle, and you're working well, you're happy, your social life is good, and what you're not able to do at home, at work, we can help you in all those aspects and within our scope of practice. And if you need more help, we can always refer to our colleagues for more help, right? You need a psychologist, you need an occupational therapist, or a massage therapist, or a chiropractor, or acupuncturist. So we have multidisciplinary clinics are there, but we can also refer outside whatever you need. So we are your health coach. I want you to remember that. And we do all the examination, then we do some tests and things like that. We do mostly, the world is moving into a functional patterns now, not a lot of movement patterns. Most of the therapists now in our city, we just don't just treat, if you have shoulder pain, we don't just check shoulder. We cannot do a kind of head to toe movement analysis and see what are the dysfunctions you're presenting with. Sometimes your shoulder pain can come from the neck or come from your pelvis or come from your knee, right? We make sure that we check, we call it bumper to bumper, and then identify all the dysfunctions and identify the cause for your treatment. Then we will explain to you, right? Hey, this is what I find, and these are the findings I do, and then let's go. Let's start treating. And we believe in manual therapy and exercise. Those are the two key factors, right? Manual therapy and exercise. Exercise is medicine, right? Movement is medicine. That's what we believe in mostly, right? Sometimes you might have to use some electrical modalities for the pain management or swelling management and things like that. But that's not the main, like a brain and not brain, sorry, a bread and butter. Hands-on therapy, and if as needed, it's not everybody needs hands-on therapy too. Somebody needs just correction of exercises and ergonomics and posture education, right? So education and empowerment is very important as a physiotherapist for the patients, and we give you proper clarity, treatment plan, and then when we tell you guys that, hey, we would like to see you twice a week for the next 3 weeks or 4 weeks, it's a prescription. We believe as a physiotherapist that visits will help you to get to that goal or take you to the finish line. We can modify that based on your schedule, your lifestyle. You can be a little bit flexible about it, and it's like a prescription. So you make sure that you stick to that and get better, right? And do not forget the time the physiotherapist spends with you. It's just the direct patient care. We also spend time for you when you're not in the clinic, right? So that's called indirect patient care. A lot of patients are not aware of that. When you're not in the clinic, we have to, if you're a workers' compensation, you have to talk to your case manager, you have to talk to your doctor, you have to do your report, we have to do your charting. There is a lot of indirect patient care involved. So that time I want you guys to remember, when you're there, physiotherapy is spending direct patient care. When you're not there, there is some indirect patient care timing for every single patient the therapist sees. She has to spend that as well. So feel free to ask questions to your physiotherapist. If you don't understand anything, they can explain to you beautifully. Physiotherapists are good educators. They can explain to you. And also, if you come with any radiological reports or anything, physiotherapists can explain to you. Because sometimes radiological kind of findings can be very overwhelming, right? Okay, you got L4, L5 disc bulge and L3, L4 disc bulge, and you have a degeneration L5, S1. Like a normal 45-year-old X-ray can look very overwhelming, seeing, oh my God, boom, 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 boom. What is all these things, right? Then it's our responsibility to explain to you guys, hey, these are all normal findings, right? And you might have some pain due to some other reasons. Don't try to relate everything to this. We can work with it, right? And we call it this phrase or mnemonics, vomit. Don't be a victims of medical imaging technology. Vomit, right? We educate you. We tell you what is right. Even if you have a disc prolapse, that's not going to last forever. Whatever the material comes out of your disc will die in a few weeks, right? Then pain is not just about the injury or the tissue. Pain is more than injury, right? So after some time, so we explain to you how brain works, how pain is perceived. The pain neuroscience is fantastic. It's evolved so much in the last 10 years. It's our responsibility to explain to you all what is it, how to approach that pain, and how you can still live an active lifestyle even though you have a problem and the pain. And whatever it is, even if you have a surgery post-operatively, how we can get you back to whatever it was. And knowledge, we constantly, as I told you, we constantly learn and study, try to implement that to help our patients. And there is another myth out there I hear from some of the patients. A lot of people think that physios and chiros are like, they don't work together. They are like in two different corners. Not like that at all. We work together. If you see, a lot of chiropractors clinics now have physiotherapists as well. Physios and chiros work together. We still get a lot of referrals from chiro. We refer patients to chiro. We kind of work together to get the benefit for the patient, right? We know what we can do better. And if you need help, we'll refer to a colleague. It's a chiro colleague. It's same like a massage therapy, right? And also still some patient thinks physios do massages, right? So I just want to tell you, massage is mostly soft tissue work. Yes, some or most of the physios, we do soft tissue work as well. You can call it as a massage. Soft tissue mobilization, that's the word usually we use. On top of that, we used to do quite a bit of joint mobilization and manipulations and exercise prescriptions and lifestyle things as well, and ergonomics and posture education as well. So we don't do, if you don't expect a physiotherapist to be with you to do 1 hour of massage therapy or soft tissue mobilization, for that you need a massage therapist. That's why we refer you guys to a massage therapist. right? We do some soft tissue mobilization, we do joint mobilization, we address what's needed, what's the session goal, and teach you a couple of exercises to work on that session goal and what the dysfunction is, and give you some home exercise program and send you home. So we add those session goals based on your big goal we have set during the assessment point of time, right? And also, physiotherapy is not only about musculoskeletal. Physiotherapy has a lot of specialities. Some of you may not know, right? We deal pediatrics. There is pediatric physical therapy, and we treat a lot of kids. My youngest patient is 8 weeks old. So my oldest patient is 94. So that's your geriatric physical therapy. Pediatrics, what do you treat with kids? What do you do with kids, right? The small babies like that. Some developmental problems, milestone issues, some torticollis and other developmental delays, cerebral palsy, or neurological abnormalities. Those things we discuss as well. And also we help teach the parents to do things for the kids as well. So we involve parents quite a bit with pediatric physical therapy, then geriatric physical therapy. Then we have pelvic floor physical therapy, where men's and women's pelvic health, right? It's very upcoming field now. A lot of physical therapists are adapting to that and training themselves to help people in that field, so that people who are pregnancies or any kind of pelvic surgeries, pelvic pain, urinary incontinence, even male prostate, or any kind of issues, you can address to a physical therapist, pelvic floor physical therapist. That's another branch coming already. Vestibular rehabilitation or vestibular physical therapy, where we deal with vertigo, dizziness, and all those stuff. Neuro rehabilitation, where we have a lot of stroke, multiple sclerosis, and Parkinson's, spinal cord injury, all sorts of neurological conditions we treat with quite a bit of neuro rehabilitation techniques, right? And cardiopulmonary rehabilitation is quite a bit now with post-COVID world. We treat a lot of long COVID patients, and we do a lot of respiratory problems. We deal with that. So your physiotherapist can be a good help for your breathing and respiration and cardiopulmonary issues as well. Then sports medicine, right? Sports physical therapy, all sports injuries, injury preventions, concussion, and sports injury management, and all those things, that sort of things we deal with. Then oncology, cancer physio, cancer rehab, right? If you have cancer, if you have surgery or no surgery, if you have radiation or no radiation, and we have protocols, we have treatment plans for you. Whether it's a breast cancer or prostate cancer or anything like that, you can avail physical therapy as well. Amputation rehab, amputation physical therapy after that, and post-operative physical therapy, any kind of surgery, right? And if they cut your muscle, you're better to see a physiotherapist. Doesn't matter if it is your pelvis or if it's your shoulder, right? It's all musculoskeletal systems. So I want you guys to understand all these specialities physiotherapists have, right? And also, sometimes you don't need a diagnosis to see a physiotherapist. Some people will say, okay, let me get my X-ray and MRI before I see a physio, right? In some conditions you need that, but not always, right? You come, physiotherapists are first-hand healthcare practitioners. They can do a good, thorough clinical examination. They come up with some clinical impressions, and we can confirm the clinical impression if you need to with a radiological finding or any kind of investigations after that. Or if you have find any red flags, we can refer back to your physician or a surgeon, and then we can deal with that. So, and also in my experience in 23 years of clinical practice, more and more neurological cases we are seeing now without any diagnosis. And sometimes I tell my patients, I do not need a label to treat you, right? I'm going to assess you head to toe, neurologically or orthopedically, and find out the dysfunction, find out your pain problems and your goals. I can start working with you, right? I don't need an actual diagnosis to treat you. That's something I just want to let you know. It's good to know a diagnosis, but if you don't have one, don't worry too much about it. We can still work with you, right, as a physiotherapist. And we constantly embracing innovations, right? Everything out there, what are the new innovations, the infrared goggles for vestibular, or Darsavi to measure your muscle work and muscle firing, and Bioness functional electrical stimulation devices for your upper limb and lower limb when it's paralyzed and not working well. When you have a foot drop, we have a superb device to work to enhance your gait and balance so that you don't trip and fall. Okay, before we used to give ankle foot orthosis. I haven't prescribed an orthosis in 15 years after the functional electrical stimulation devices came in. So we enhanced your life by bringing in the products, very highly innovative products, into the clinics to help our patients. So these are the things I want to touch up to know what it takes to become a physio, what you can expect from a physio, what physios expect from you guys, different specialities. Physios and chiros are friends, they work together, and we have different specialities. We don't need diagnosis to see you. We don't need doctor's referral to see you. You can come and see us directly. If you need help, we can refer you back. We embrace high innovation, And we also study all the time. We learn all the time. We do direct patient care. When you're not in the clinic, we do indirect patient care for you as well. So if you have any other questions about physiotherapy, physiotherapists, how to become one, how what to expect, or what are the specialities, or any questions, can this condition be helped or whatever it is, shoot an email. Okay? And all our previous episodes are archived in physioshow.ca. You can go log in and check out all our episodes. And if you have any questions, please email me, giri@physioshow.ca. I'm more than happy to answer that. And until next time, July, we are thinking we might do something about golf, and because I treat a lot of golfers and there are a lot of golf questions. So we will see what comes up for next month. I don't have a schedule for the whole year. We kind of think what is right now, what we can talk about, and we just go with it. And hope you enjoyed this. Hope you understood a little bit about physiotherapists from a physiotherapist. And I will see you guys in July. The world is opening up, and Edmonton is opening up. Alberta is opening up. Enjoy yourself. Be safe out there and have fun. Enjoy the summer, and love you all. See you guys. Bye.